Hi, everyone, and welcome to Gigging Out. I'm Dana Gagnon, CMO at Every, and in this episode, I'm joined by Patti Artley, Chief Nursing Officer at Medical Solutions. Patti and I discussed Medical Solutions' new Voices of Care survey, which gathered insights from 7,000 registered nurses across the U.S. We talk about what motivates nurses to choose travel positions, with pay and flexibility being key factors. Patti also shares findings on job satisfaction and touches on the ongoing issue of burnout and how it's evolved post-COVID. Additionally, Patti covers how nurses feel about compensation and what it takes to retain nursing staff in today's competitive environment. I know you're going to learn a lot from this episode. Enjoy. Right. Wonderful. Thank you so much for being here today, Patti.
Thank you for having me.
So I would love it if you could just start off by telling the audience a little bit about yourself and what you do at Medical Solutions.
Sure. I'm Patti Artley. I am the Chief Nursing Officer, Chief Clinical Officer. That means I'm really responsible for the care of that the travelers that we serve produce for our clients. And I'm responsible for their quality of the care and making sure that everything that we're doing is meeting the traveler and the client's needs.
Well, I'm super excited to talk to you because Medical Solutions just put out a survey, Voices of Care survey, which looked at data from 7,000 RNs nationwide. It had some really interesting findings, so I want to dig into those with you. But I would love to just kind of start off with a little bit of an introduction into the report. What kind of questions were you looking to answer? How did you go about it? If you could just tell us a little bit about the report, that would be awesome.
So the Voices of Care survey, this is our second year that we've actually run this. And the reason that we decided to embark on this survey is really to gain some insights on the experience and the perceptions of registered nurses. The registered nurses have been under a lot of turmoil and a lot of transition, I would say, since COVID, and really understanding their intentions, both from a recruitment and retention strategy, and get insight on what they're thinking so that we can translate that to our clients and our partners to help them actually retain and recruit in a different way. When we were conducting the survey, we actually used the database of the travelers that we had. Some of them may be current travelers, some of them may have worked with us in the past, and then others may have never worked with us, but they registered to work with us. So we gained insight from all of those individuals that some of them were on assignment with other hospitals, or they've joined other hospitals as their core staff. So it was a wide range of and a broad spectrum of nurses that supplied and participated in this.
Speaking of that, so one of the questions was really looking at what motivates a nurse to take a travel position over a permanent placement. Can you speak to a little bit of that motivating factor? What are the things that they value about those different roles? And how do they ultimately choose what's right for them?
Yes, so I don't think the first thing is going to surprise you. The first thing that we did learn was that 97% of those nurses that said they were motivated to travel, and the number one thing was pay. So those individuals that truly left a bedside to go to travel did so primarily because of the pay differential. And I think that has probably contributed to us see a shift in those nurses that at some point in their career decided travel might not be for them because the pay has decreased a bit. So we're seeing more individuals take those core roles than we did during COVID. The second reason that we heard really was twofold. So there were two things that were almost tied at a little over 85%. And one of them was because of office politics, or the politics in the organization in which they worked. They wanted to get themselves out of that arena because they felt that it was too political, or there were too many different competing challenges related to the politics in the organization. The other thing that we learned is that the third reason was really flexibility. They wanted to make sure that they had flexibility and ownership of their schedules a bit more. They wanted to create a better work-life balance, and they felt that travel allowed them to do that. We heard from the survey that they want to be able to take time off during their assignments, that it allowed them to meet personal and professional needs better than when they were employed by a hospital.
It's interesting that the office politics ranked so high. We've also seen in some data that some of the reasons that people fear travel nursing is that they're worried about going into new environments all the time. So it's kind of this duality there. But yeah, I can imagine that just changing up the environment and getting to meet new people is a perk in and of itself as well. How do you think nurses feel about their current jobs? What's job satisfaction look like according to the report?
So the report shared that 57% of nurses, and I'm doing rounding, instead of like 57.3 or 57.5, but 57.3% of the nurses in this one actually said they were satisfied with their current work. So that I think was much better than what we had seen in the literature that we're seeing in the literature. So I think that was positive. And among those that said, I'm satisfied with the work that's done, the reason they're satisfied is when they find their work rewarding and meaningful. That was the number one reason why people do what they do. They feel like they can make a positive impact. Their patients outcomes are good, and they feel like they can advocate on behalf of their patients and make a difference. So that's the number one reason why people are satisfied with their job. The other thing that we heard was if they're satisfied as the career in nursing. So we dug a little bit into that, and genuinely 78% said they are genuinely happy with the choice of nursing, the career choice that they made. And they seem, and this isn't unusual, and this is normal to pre-COVID to now, they feel that this isn't just a job for them. It's the calling. This is a profession that they chose to be in, and it's hard work, but they're still really satisfied with what they're doing. Individuals that said they're satisfied is when their teams are a huge part of them feeling satisfied with the work that they do. So team camaraderie was in the 77% range, and really does drive the kind of environment that people want to work in, that they're collaborative, people work together, they have common goals, and they feel very supported in doing that. One of the things that we learned in this survey was that when they are able to have a manageable workload, and we know that ratios have been a challenge since well before COVID, and really how they provide care and feeling like they do a good job. That's why the workload is so important. When the workload is stretched and they don't feel that they have enough team members to do the jobs to get them done, that their job satisfaction and personal well-being is low. So the only other thing that I'd like to really speak about is when they feel it was very important, and this was another really high one, 72% of nurses felt feeling respected and heard were critical to staying in their job. And this is one of the important parts where this creates the environment in which people want to work, that their voices are being heard, that they are making contributions and acknowledged for those contributions, and that they are able to participate in helping make their lives of the patients and the lives of the environment in which they work better. So those were some of the big takeaways from this survey. And I don't know that any of them were really surprising, because we've heard this in other venues as well as last year that's synonymous with what we saw there.
I think what's really interesting about being heard is I've talked to traveling nurses, I've talked to staffing agencies, and it's about not just making sure that your permanent staff feels heard, but that your travelers, your per diem staff feel like they're part of that team, feel like that they have an outlet to voice their concerns or feedback. And so I think that's what's interesting, that you had nurses of all different types of employment, and that feedback is probably very similar no matter what kind of role they're taking.
Couldn't agree more. And when you think about the what we heard from them earlier on, everything there is about that environment, right? Or the pay. So those are the two big things. So all those things that we just kind of went through really create and contribute to that kind of environment. So making sure, if you're a nurse leader, that you are putting that infrastructure in place that welcomes the traveler, because many travelers are deciding whether or not they continue to travel or do they shift and join an organization? If they don't see those things where they're traveling, they're definitely not going to stay.
I know you dug in a little bit in the research around salary and compensation specifically. How are nurses feeling? Are they feeling well compensated? I mean, everybody always wants more money, but would love to kind of hear, what do you think, like how are nurses generally feeling about how they're compensated?
It wasn't overwhelming that felt that they were fairly compensated. So the numbers that we saw were 42.8% RNs feel they're fairly compensated for the work that they do. And I think that is synonymous with how most people feel about their jobs, right? Most people do not feel that they are paid for everything that they have contributed to the workforce. And I've shared this before. I have 3 grown children who are all out in the workforce, not in nursing, but some are in healthcare, some are teaching. And when I asked the exact same questions that we asked on the survey, I had some similar responses. But one of the things that I think was important was that 47% of the people that filled out this survey said they're willing to leave the job they do now or nursing for better salary and benefits. So that's a pretty strong number, that almost half of the people that filled out this survey said that they would leave for better salary. And then when you think about the fact that we had 82% said that salary increase is their biggest influencer in retaining them in the profession, not necessarily in the job that they're in, but in the profession. So I think that's really important. And I think it's probably in alignment with where many other people are, not in just in our profession, but other careers.
Let's talk about burnout, which I think is common in the nursing field, probably more than a lot of other fields. I can only imagine the stress of that job. How significant of an issue is burnout for nurses today?
Well, I'd say it's pretty significant. Burnout has been a challenge for us well before COVID. Workplace violence is on the rise. It has, and I don't even know if it's worse right now than it was, but it's definitely more reported than it was in the past. And that really contributes to nurses in the way they feel about providing the care and being a part of an organization. So what we learned in the outside literature says that nursing burnout is on the increase, but our survey, which I thought was pretty interesting, said in 2022 nurses felt that stress and burnout were worse at 43%, and they actually said that it was better because they only 39.2% of those who answered the survey actually said that stress and burnout was what was contributing, was causing them concern, so that they felt that they were burned out related to some of those. And I think it's really interesting that during COVID, most of the burnout that we saw was really related to, that mental anguish, the fact that we had moral distress, we had isolation from families, we had watched death and dying. The mortality rates were higher. They were shortage of PPE, so they felt that there were just a lot of contributing factors, and a lot of it was that moral distress of not being able to provide care in the same way. Whereas right now, what we're seeing is a little bit more of that burnout being related to frustrations in their job. And I think that's where the shifting of the paradigm is happening. It's unresolved problems in the workplace. It's that long time inadequate staffing that we've seen. A lot of them are saying it's related to how they have to onboard so many of the new graduates. There's that experience complexity gap that is out there because we've continued to onboard. We lost seasoned nurses, and now what we're seeing is really newer nurses with that novice experience level. So those individuals that are there who are precepting them continually are really frustrated, and they're seeing that they're burned out related to all of the turnover that has taken place and the novice nurses that have joined their teams. So the challenges are very different, and that's, I think, one of the things that we have to recognize. So the things that bothered them in 2020 are very different than what's bothering them now in 2023 and 2024.
That's such a good point. I think sometimes it's the pandemic feels like it was yesterday sometimes, and it also feels like it was a lifetime ago, but it's important to think like 4 years is a long time, and things can have these huge shifts in that time. Do you have advice for, organizations or facilities? What can they do to mitigate burnout and help their nurses? How can they, you brought up staffing shortages. Like, what are some things they can do to improve and alleviate some of that burnout?
Sure. One of the things I think is most important is that this is not a one size fits all, right? And what works for what the problems are in one hospital can be very different than the problems in the other hospital. And what we're seeing based on the level of frustration of the nurses, of them telling us what the problems are and then not seeing it fixed. I think that's the first thing you have to understand is what is the problem that you're trying to solve in your organization. That's one of the biggest things, and that's creating and really contributing to the type of environment in which they want to work. So making sure that you have an infrastructure where their voices are heard, and then you're taking the voice of what they're telling you and translating that to a solution. Too often, leaders will listen to it and the problem might be so immense or the problem might be so large, but not having solutions to what you continue to hear and just say, well, parking's been a problem all along or staffing's been a problem all along, and not fixing it really doesn't allow your team to feel like they are being heard. Obviously, compensation and benefits, because they're so important to the nurses' retention, and knowing that 47% of them could leave if they had a better job, or better salary, I should say. That leverages us to say every year making sure that you're looking at the compensation in your area. So whoever you're competing against, making sure that your salaries are competitive. And then, while we know finances are tight, so the salary isn't everything. If they feel like they have options, flexible scheduling is really important right now. We know that in some places they've had to go up and many hospitals have had to increase ratios. So how do you layer on other options? And then if one of your big problems is that you have so many novice nurses, how do you work to retain those seasoned individuals, those individuals that are experts in the practice at the bedside, and how do you work towards keeping their skill set there? How do you work on supporting the preceptors and looking at how you onboard is really important. I know that I just read a study that actually said that within the first week, 80% of millennials and Gen Zs broke down that was important to them. They knew that in that first week, whether they were going to stay with an organization, whether it was a good fit or not. So making sure that your onboarding practices and your orientation are solid is really going to start you off on the right foot. We also know that they want to know that they're going to be invested in, and making sure that you have career pathways, you have processes and programs that are in place to really grow and develop them, because they're not like the nurses of my age or my era, where we started with an organization and we might have been there 20 plus years. That's not going to be the case unless we can continue to grow and invest in them, and making sure that they have a venue for professional growth and development, and recognize they're not going to stay in the same unit, and that we're going to have to provide opportunities like transition programs where they can start in a med surge and then they can go to progressive care and develop into ICU, and how you're going to foster that to make them feel valued and growing in your organization are going to be extremely important. So making sure that those infrastructures are there. If you don't have a nurse residency program to get that first year nurse off on a good foot, then that's going to be critical for you to put that infrastructure in place. We know that 33% of first-year nurses leave their workforce, and so making sure that they get started and supported in that first year positions them for success. And so that's really important as well. One of the things that I briefly spoke to, and I think touched on, was really that unsafe work conditions. And we know that by the survey, almost 35% said that if they had unsafe work conditions, they would leave nursing. And that's really making sure that you have an infrastructure to keep them safe. That there are things like code lavenders that are programs that support them at the bedside, behavioral response teams. So when they feel that things are escalating, that there are other team members that come in and help keep them safe. Making sure that they feel like they're supported mentally. We talked about burnout and how we support the teams there. 40% of our individuals that were surveyed said that they would leave if they felt burned out or that they felt that they had too high of stressors on the units. So making sure that you have a finger on that pulse and that you're supporting them in the right way, I think are critical.
I'm curious. I mean, a lot of that applies at a facility level, at a hospital or health system. As a staffing agency, is it very similar things that you're trying to replicate to retain the nurses who travel for you? Are there things that are maybe a little bit different? How do you think about retention in your world?
Yeah, we do. Actually, we measure how many assignments they stay with us. And so we are putting a mentorship program up to make sure that they're supported. We have a clinical queue, and I have clinical nurse managers that actually are there to help support them. So if they think they're going to leave an assignment early or they're challenged by a situation, they can contact a clinical nurse manager, and those nurse managers walk them through and help them problem solve and help remove barriers for them. In addition to that, we do that on the client side too, making sure that our teams are well positioned for success. So we learn from each and every quarterly review. We look at why individuals leave assignments and what they say about that. So we survey every traveler who leaves an assignment, whether it's at the formal end of an assignment or if they left early, and try to understand what can we put into place to help support them better. And we work with our clients to make sure that they understand why people did leave and why they what they can do to help mitigate some of that. We're always looking at competitive pricing so that we are making sure that we are offering roles that are competitive and in the marketplace, so that we can keep the travelers traveling with us. So I think there are really similar things that we are doing on the travel industry, and making sure that their voices are heard, making sure that they feel well supported, that they have an outlet, that their pay package is appropriate. And we want to make it easy. We want to make it simple for them to be able to get on their job and do their job.
I mean, kind of in that same vein, I'm curious. I know the survey looked at what factors go into how a nurse selects the agencies that they work with. Can you speak to that at all? Like, what do you think are the key factors that they look for in agencies?
Yeah. So, that varies a bit, but some of them said that it's the recruiter. They want to make sure that they have a strong recruiter relationship with their recruiter. So it goes back to that relationship that they have. They also want to know that there's competitive salaries. That was like 99.7%. So that was pretty strong, that they are looking at that as their number one. That's the number one thing that they're looking for. And then they want to understand, they want to work with a place, and this was almost 99% of them said that they want to work with an agency that has a clear understanding of understanding what I need and what I want, and that they respond quickly. And so we want to make sure that we put those infrastructures in place, and then they want to know that we're transparent in not only the pay practices, but what we are doing from a quality and safety perspective as well. And honestly, that didn't change much from our last year's survey as well.
I'm curious what trends you're seeing and how nurses are searching for job opportunities or searching for the agencies and the recruiters that they're engaging with. Any trends you're seeing there?
We still have online individuals. So 56 or 55%, I think it was, said that nurses are looking at online platforms. So they're leveraging and leveraging that digital platform or some level of online job hunting. We did see that 51% of our nurses said that it was important to network and word of mouth. So they're leveraging their colleagues, that what was that job like. So they have a lot of networks that they leverage. There are a lot of different social media platforms out there that they are also recognizing as important. And then, like I said, 40% of them said their engagement with their recruiter was the most important thing. So most of them are digital platforms. Second was word of mouth, and third was their recruiter.
So you have all this amazing data. How does Medical Solutions take this data? Are there things that you implement from it? I'm curious if it changes your approach after you get the data back from these nurses. Could you speak to that and what really makes Medical Solutions different in the industry?
Yes, we take this data and we not only we review it and look at it and determine what do we do well and what don't we do well. So we are working really closely with our clinicians and our clients to really create a more seamless digital platform. So constantly improving the technology and the experience that our clinicians are seeing, and making sure that we are continually raising the bar on how we credential them and the ease and the speed that we get them credentialed so that we can get them on assignment with as little barriers and hiccups as possible. We are working with our clients and sharing this data so that they can not only recognize as well what we hear from clinicians and what makes them leave their workforce or what would draw them back in. So actually, this is part of our quarterly business review, sharing data that we receive from this survey so that we can help educate them and help work with them so that they can really take the temporary workforce and their contingent workforce that they have in the travelers and try to convert them to permanent. And that's really part of how we're a good partner to the individuals that we serve.
I'm curious, just kind of like zooming out a bit, do you have any predictions for sort of the next couple of years, 2 to 5 years for healthcare staffing as an industry as a whole? What are some of the trends or changes that you foresee maybe coming?
Looking ahead, we're going to be more computerized, and I think there is going to be a shift in leveraging AI to play a bigger role in this. You see some of the organizations right now, their recruiters are really digital bots, and how they're going to leverage that and how we match individuals. So what they say to us and what they tell us they're interested in, how do we quickly create that kind of match for them? So I do believe that AI is going to play a huge portion in moving this faster and maybe even better than we do with it as a human in making those kind of matches. So I think that we'll see a little bit of that. I think we're going to see as more of the baby boomers retire. And I thought what was interesting was that a lot of our individuals who filled this out were over 30. And we did have a significant number of individuals who are Gen X's complete the survey. But I think and we still saw that automation was important. I think that's even going to be more important as our Gen X's and baby boomers are retiring. I think we'll see a lot more expectations that we're going to make this do it now and do it fast. And that push is going to be on us. When we look at the number of nurses who are licensed in the field, we have more licensed RNs than we've ever had, and yet we still have a bigger gap at the bedside. So I do think that we're going to have to be creative. We're going to have more workforce jobs that are going to be away from the bedside. I think virtual nursing is going to be a critical element in how we provide care in a very different way, leveraging technology in different ways to provide care. I think we're going to see, that virtual nursing, I think we've only scratched the surface of that. Those that are providing that care are really doing a lot of the admission and the discharge and med reconciliation as they're upfront, but really case management and how we manage the patients outside of the hospital and more in an ambulatory setting and chronic disease management. I think we're going to see a lot more staffing in that area as well, because those are where we're seeing the new roles and the new innovations. And so I think that will be staffing there as well.
It's interesting you bring up like the AI, and I see, there's like this kind of push and pull with recruiters of like, oh, is AI going to replace my job? But then on the flip side, you hear from nurses that the personal element is the most critical thing for an agency, and it's why they want to work with an agency over like take other gig work where it is nameless. So it'll be interesting to see how that plays. I think there'll always be that human element as a component of that.
Agreed. And I say that to nurses all the time. When we were trying to implement early warning systems, and this was when I was a chief nurse at a hospital system, it was really helping them understand, how does it help you make better decisions? It's not going to replace your job, because it's all about how you make them feel, and it's that human touch. And we're in a human touch industry, and it's a caring industry, and you can't make a robot do that. But how do we create the opportunity to pull data elements? When we look at early warning systems, they go anywhere between 22 and 40 data elements, or 56 data elements, depending on the systems that you're using. And they're taking all those elements and they're helping you make the right decision for your patient, recognizing early that they're getting septic. And for us to go through a chart and find all those elements that we have documented over time, and what the monitor is saying and what they're helping us do, right? That the temperature's going up and the urine output's going down, and all of those things that you're having other people help you with. Texts are documenting those things, and you might not have even seen them, and they might not have put them together, but you see it in an early warning system where they're pulling it all together. So those are the kind of things that I keep reminding our nursing team of. These are just helping us work smarter and work and practice to the top of license, rather than taking away our jobs, right? And who doesn't want to do that? We go into school for 4 years. That's what we want to do.
Thank you so much. This has been a great conversation. Really appreciate you taking the time to share these insights with us.
It has been a pleasure. Thank you for inviting me, Dana.
This podcast was brought to you by Every. We work with gig companies, marketplaces, delivery businesses, and more to pay their workers fast. You can learn more at every.com.